Today we're going to be talking about H. pylori or Helicobacter pylori infection. What are the symptoms of it? What is the diagnosis? And then what are the treatment options? Just to start this video, I am a nutritionist. I am not a doctor. If you would like your doctor's advice, please go and speak to them. Don't take anything here over what your doctor has already given you. So H. pylori is a bacteria that is super contagious. Scientists think it infects around half the world's population. Now, in some people, it does absolutely nothing. But in the other people, it can cause acid reflux, it can cause stomach ulcers, and it can even lead to stomach cancer. Now, the most obvious symptoms for me of H. pylori are the following three. First is having pain inside the stomach, which is right around this region here. It's much higher than most people realize. They think stomach and belly and bowel, they're all kind of connected. They're not. They're kind of separate regions of your digestive system, and your stomach lies around here. Pain in that region could signal H. pylori. Another common symptom of H. pylori is nausea, and that's because H. pylori can infect your gallbladder. And when you infect a gallbladder and it can't produce enough bile, then you struggle to digest fats, you get super nauseous, and you can get acid reflux from it as well. Another common symptom of H. pylori will be constant acid reflux, because what H. pylori does is it creates an enzyme called urease, and that urease decreases your acid production, which stops your lower esophageal sphincter from closing. And when that happens, you get acid from the stomach coming up into the esophagus, causing acid reflux that doesn't seem to get better or worse, doesn't respond to food, and can even cause acid reflux and pain inside the chest, even when drinking water. Finally, for me, the biggest symptom of H. pylori is that you were fine one day and all of a sudden you woke up one morning and you had these problems. And that's because that bacteria is contagious. You catch it from other people, you can catch it from food. So if you were fine one day and all of a sudden you're struggling, it's almost likely you have H. pylori. Now let's talk about the testing and the diagnosis for H. pylori, which in my opinion is not up to scratch. The most common one and the cheapest and the easiest to do is probably a breath test, followed by a stool test, followed by a blood test. Now, in my opinion, there are very high numbers of what we call false negatives, where you actually have H. pylori, but your test is coming out negative. And that's because H. pylori doesn't survive in the stool. It doesn't always produce enough byproducts to catch in a breath test, and the blood test I think is wildly inaccurate because it will just show antibodies. It doesn't show whether you have a current infection, whether you had an infection previously. They're just not great. For me, the best test is by far an endoscopy. That's a gold standard test for testing H. pylori. They do a biopsy, so they take a snip of your stomach after the camera goes down, and they test that tissue for H. pylori. What you need to know is that the science says you need to be off your PPI medication for at least 15 days before you have your endoscopy. Otherwise, you have a 56% chance of a false negative. Again, that is a test result that comes back and says you don't have H. pylori, but you actually do. And these cases are the worst possible scenario because you have H. pylori and you just don't realize. That means you can't get antibiotics. If you wanted them, it causes a whole load of other problems. So just be aware that the testing for H. pylori is not great. If you was one of my clients, we normally go via symptoms. Let's talk about treatment options. First, I'm going to tell you what the doctor would give you, and then I will tell you what I would give you if you was one of my clients using some herbs. So they will give you what we call triple therapy, which is omeprazole plus 2 different antibiotics. And there's a pretty harsh treatment, if I'm being honest with you. It is pretty savage on the digestive system. Whenever you take antibiotics, there is always damage to your microbiome. Now, some people can get away with it and they seem to be fine. But lots of other people, the antibiotics doesn't even work. And if you go back to the doctor, they'll give you more and more and more. I think I saw someone take 7 rounds of antibiotics for H. pylori, and even then it still didn't work, which is one of the reasons I created a product called Pylori. Now, Pylori contains 5 different herbs to not only kill the overgrowth of H. pylori, but to reduce the inflammation and pain associated with it. Now, I always want to use herbs before I use antibiotics where possible. If you get gangrene or you have a serious infection, then obviously you want to use antibiotics. But if you can save your microbiome and try something herbal first, like Pylori, I always prefer to use that route with myself and with my clients. Hopefully you now know a little bit more about H. pylori, some of the symptoms and some of your treatment options. Hopefully this was helpful. I'll see you in the next one.